Hi, I'm Dr. Emily Clarke. I've spent 15 years in geriatric medicine and men's health. Today I'm speaking to men over 50 who want steadier energy, better circulation, and more reliable performance. This isn't about gimmicks or quick fixes. It's about giving your body simple minerals so it can work better. Plain water restores volume but won't replace the electrolytes your cells need to communicate, relax vessels, and move blood quickly. Think of magnesium, sodium, and potassium as the tiny electrical sparks that tell tissues to open and let blood flow. After 50, this matters even more because thirst signals blunt, kidneys handle salts differently, and arteries grow stiffer, so you can drink plenty and still be undercharged with tighter vessels and weaker microcirculation that reduce energy and sexual performance. Erectile tissue and peripheral circulation rely on rapid local vasodilation, charging your water supplies the ions that support that response. If you take blood thinners or have kidney disease, check with your doctor before trying any new mineral. Magnesium stands out. It relaxes smooth muscle in artery walls and erectile tissue, supports cellular energy, and helps hundreds of enzyme reactions. For most older men, a bioavailable form such as magnesium citrate or glycinate absorbs reliably and is gentle on the stomach. Dissolved in warm water, it may be absorbed faster and begin to support circulation and relaxation. Start low. For example, try 1 or 2 teaspoons of powdered citrate in warm water for 3 or 5 days, then increase to 1 teaspoon only if tolerated and per the product label. Many men notice subtle gains in steadiness and energy within days, with clearer changes over weeks. If you take blood thinners, heart or blood pressure medicines, potassium-sparing drugs, or have kidney disease, check with your doctor before trying magnesium. Magnesium is often the best first step, but a few supporting minerals can make the effect steadier. First, add a very small pinch of unrefined trace mineral salt, sea salt or Himalayan, to help hold fluids and support blood volume. This is for trace use, not extra table salt. Potassium balances sodium and keeps cell pumps working. If you sweat heavily or eat few fruits and vegetables, try a low-sugar potassium electrolyte. Follow the product label and avoid these if you're on ACE inhibitors, ARBs, or potassium-sparing meds. Third, zinc supports male hormones and immunity. Take 2 to 3 liquid drops with a meal to improve absorption and cut stomach upset. Finally, only consider iron if a clinician confirms you're deficient. Don't add everything at once. Start with one change, wait 3 to 5 days to gauge how you feel, then layer another if needed. If you take blood pressure drugs, potassium-sparing meds, or have kidney disease, check with your doctor before trying any of these. Try one of these simple morning rituals for 3 weeks. Start low, track how you feel, and don't add more than one change at a time. Ritual A. Vascular boost. Dissolve 1–2 teaspoon magnesium citrate powder in a large glass of warm water, about 12 Oz. Sip slowly over 5 to 10 minutes. Stay at 1–2 teaspoon for 3 to 5 days to check tolerance. If okay, increase to 1 teaspoon only per the product label. Track steadiness when walking, mid-morning energy, and any digestive changes. Ritual B. Salt foundation. Add a very small pinch of unrefined trace mineral salt, about the tip of your pinky, to a large glass of water in the morning. Stir and sip slowly. Track morning fullness, ease of faintness, and daily energy. Optional add-ons, only after 3 to 5 days of one change. Potassium, half-scoop low-sugar electrolyte after heavy sweating. Follow the label. Avoid if on potassium-sparing meds. If you take blood thinners, heart or blood pressure medicines, potassium-sparing drugs, have kidney disease, or are pregnant or breastfeeding, check with your clinician before trying any new mineral. For magnesium, begin with half a teaspoon of powdered citrate or glycinate dissolved in warm water. After 3 to 5 days, increase only if tolerated, and follow the product label for maximum dose. For trace mineral salt, use a tiny pinky tip pinch once daily, not extra table salt. Follow the product label for potassium products and avoid them if you take potassium-sparing medications. Take zinc drops with food to reduce stomach upset and follow the product dosing. Only use iron if a clinician has confirmed deficiency. Watch for common responses. Mild loose stools may occur. Lower to the last tolerated dose and stay there. Small gains in energy, steadiness, or exercise recovery often appear within days to weeks. If you notice lightheadedness, an irregular heartbeat, severe stomach pain, swelling, or persistent digestive distress, stop the new mineral and contact your clinician. Thanks for trying this simple approach. If you take heart or blood pressure meds, are on blood thinners, take potassium-sparing drugs, or have kidney disease, check with your clinician before starting. Start with one small change, track it for 3 weeks, and notice how your energy, steadiness, and recovery respond. If this helped, like the video, subscribe for more practical senior-focused tips, and share it with someone still drinking plain water. Comment below which ritual you'll try first, magnesium or the salt primer, and I'll answer common questions in the comments this week.